Brother mute didn't work this time. Thank you, Chris, for shedding some light on the often misunderstood nexus between academia and industry. It's really great to have an insider perspective to describe some of the similarities and some of the contrasting elements of working in industry. I really love that notion of bringing academic rigor to industry processes, and also that long-term goal that some researchers might like to consider, for example, striving to see their research in business decisions or into practice. So now we're moving on to invite our three speakers to our Q&A panel. So make sure to keep sending through your questions in the chat box or through, not chat box, the Q&A box, or through Hoover. So welcome back, Sam, Chris, and Christian.
Thanks, Penny.
Now, my first question comes from Emily Bell, and Emily says, thanks for a great presentation, Samantha. Your tips will be very helpful in getting published. She's got $1 million question here. How many publications do you think you need in order to be competitive for postdoc positions?
A magic number. Good question, Emily. If only we knew. No, there is a little bit of data around this, Emily, that I can share with you. So there is some data to suggest that if you have 3 first author publications at the end of your PhD, then you're probably in a good position to be applying for a postdoc position. So, so there is some evidence to support that. As far as applying for fellowship funding, that's a little bit of a different kettle of fish. So typically what we'd be looking to do for a fellowship application as a postdoc would be to apply for the NHMRC investigator scheme. And so an investigator grant has different levels in which you would apply for. The emerging level 1 is typically you'd be targeting as a postdoc, as a new PhD. In those early phases post-PhD. And that's typically anyone applying between the first 0 to 5 years postdoc. And when you look at the data on who has been awarded those grants, there's an average number of publications, and I think I've got it here somewhere. I think it's around 35. Yeah, so 35 is the average number of publications that somebody being awarded a postdoc fellowship has, but it's all relative to opportunity. So take that into account. That would definitely be something that they would be looking at. A review of an application would be saying, you know, are you in your first year as a postdoc, or are you 5 years postdoc? And there'd be really different expectations around your number of publications at any point in time. So it's all relative to opportunity in that sense.
Thanks so much, Sam. Definitely good to note relative to opportunity. A few Opus babies have been made in the last 2 years, so definitely good to consider that as well in the mix. We've got a question from Sid here. This one's for Christian, or maybe even Sam would like to jump in with this one as well, not to exclude you, Chris, you can too as well. But what are some of the barriers that we need to lift to increase patient participation in non-surgical interventions and management? So this one's come from Sid.
Sure, that's a great question, Sid. I think if we look for the biggest lever we could possibly have, that would be changing our healthcare system funding model, and that would be funding to support non-surgical care. If we change that, that's a game changer, because that will incentivize everyone else down the chain to actually provide that care. So it will incentivize health practitioners to train, to provide optimal, let's call it education and exercise and dietetics. It will incentivize health services to offer that, because they'll be remunerated for it as well. And that will, in course, lead to universities then offering teaching and training around that. So it's kind of that top-down approach. So that's absolute key. And if we're going to have equitable access to this type of care, that's what must change. There's lots of reasons that's not changing now, and there's lots of reasons I don't see it changing as much as it needs to in a hurry as well. So that's the first thing. I think if we go back a step from there, I think if we go from the bottom up, I think one of the ways we can improve things is thinking about how to educate the general public about what is appropriate care for musculoskeletal pain more broadly, so not just osteoarthritis. And if we can educate the general public about that, that's going to force them to demand that care when they go and seek healthcare advice. And as a result of that, that would then change practice as well. And then alongside all of that, regardless of whether it's top-down or bottom-up approach, we need to support health professionals to provide that type of care as well. So lots of training. So that's probably, short answer. I could talk about this for hours.
I don't doubt it. And Sam, did you want to add anything to that?
No, I think Christian captured that beautifully. It's just that idea that we've got, micro, meso, macro level factors here, and there are barriers at any point along there that need to be addressed.
Sid's got another really great question aimed at Chris. So what are some of the ways that PhD students and early career researchers can start to build industry connections, and where should you approach people?
Thanks, Penny. That's a great question. And look, I don't think that all of the emphasis needs to fall on you as a young researcher to magically have all these great connections with all of the big corporates and all of the industry. But there are things that you can do, and one's just being really proactive with your immediate supervisors and connections, and saying, hey, I'm just playing an active role in discussions with them. And so then when, say, someone comes from a corporate and writes an email to someone and says, hey, we've got a small bit of research. Do you have anyone on, in your student list who would be interested? Then those connections can be made. And so I think, the first step is just about being really positive and proactive in what you're doing, and not just being completely focused and narrow around your PhD. I know that often a PhD can just draw you in and make you just really completely focused on that. But it's always worthwhile just taking a step back and trying to see the bigger picture, so that when some of those other opportunities come up, you can be a little bit flexible to just start to take those opportunities. I can personally attest to that one of the private health insurers came to my supervisor when I was doing my PhD and said, hey, do you have anyone who can run a few models and do a bit of math on a part-time basis? And I ended up doing that, and that led to a whole range of further collaboration, including the example that I presented earlier.
Awesome. So taking the blinkers off a little bit in your PhD journey and looking for those extra opportunities. That sounds like very reasonable to me. We've got another question from Emily. And she says, thanks for a great session, Christian. What can we do as individuals to contribute to translating evidence and implementing change?
As individuals, that's a good question. So I think the more people that we can have call out what is broken within the system, I think the better. I think voices become very loud when there's a collective of them. So I think that's really, really important. And I think probably thinking about that with your research as well, and I guess hopefully it's come across a little bit in my talk, is when you're doing your research, not just researching what should be optimal care for people, but then thinking about how you can then translate that into practice. So if your research area is a treatment X for condition Y, and treatment X is a higher value compared to what's traditionally happening, then don't just stop there and then, okay, well, let's just compare that treatment to something else and build on that. But have a think about how can you actually get that message to patients, have a think about how can you get that message to health professionals. Is it messages that you need to get through to funders? So do you need to build the networks? And I think Chris's presentation on industry was great, because you can see really clearly that some of the work he's been doing is having that immediate impact. And I think sometimes us as researchers, we do this research, and I'm a typical example of this. I get so frustrated, so incredibly frustrated. And GLAD's a great example where we've got this program that could save the public and private health system hundreds of millions of dollars a year. But when I have conversations with Medibank Private and other, other private health insurers, there's this real wall and block to getting it funding, and there's lots of reasons that happens. And perhaps what I need to do with my own research in the beginning is to involve those types of stakeholders in it and talk to them and work with them, because then it's more likely to have that immediate impact. So I think thinking through it from the very beginning as individual researchers is probably really, really important.
Thanks so much, Christian. Claire's got a question. She says, also thank you to all of the panelists. And the question's for Chris. What's the best way you've found to reach out and connect with industry? So this follows on from the last question, but she also mentions what are the warning signs that a partnership might be more trouble than it's worth?
Yeah, I'll tackle the last bit, and I think we've kind of spoken about the first bit already. It's a real challenge, right? But what I would suggest is that you really be clear about what you're trying to achieve with any collaboration. And the things that we went through before are really critical, and I'd suggest that you talk to your supervisor about them as well. Because as an economist, what we're really critical, what we're really cognizant of, is that we've all got opportunity costs. So if you go and devote 6 months to a collaboration that actually doesn't give you a publication and has poor funding and no data and not much rigor in terms of the ability to do, or to use a good research design, then is that actually going to help your pathway and the trajectory that you're on as a PhD candidate or as a postdoc? So you've just got to think through what are the things and what are those barriers looking like, and which are the ones that you can say, yeah, look, I can handle the fact that I can't publish in this instance because I'm going to get great collaboration. We're going to change a model of care in a real world situation. So, okay, there's some other benefits. And so it's really just about weighing those up and walking into any collaboration with your eyes wide open. They're not all going to be perfect, and I tried to highlight that in my kind of my middle example. But even non-perfect ones can still be really positive if they've got the right features. So yeah, just walk into it with your eyes wide open. And it's actually something I say to all researchers, is that actually they've got a lot to offer, and they shouldn't just always say yes to stuff. I really believe that strongly, that actually sometimes you've just got to value your own time a little bit more and weigh that up a little bit more.
Thank you so much. I've got a question for Sam, but I'm also going to open it up to the rest of the panel. So Sam mentioned that a lot of people, non-researchers or non-clinicians, are accessing research papers and journal articles of late. So how can we make sure that when we write, that we're bridging the gap between the academic language and writing that is appropriate for a lay person? Not that I like that term.
Look, it's a great question, and I don't mean to handball it, but Christian, I think you do this so well that I'd love to hear your thoughts on it. Can I handball it to you?
Naughty.
Sam,
it is
that's
naughty,
great.
But you do.
So, yeah. So I think you have to really think through who your audience is. I think that's a really key thing. So if you've got your audience in mind, and then you need to think through the message and what would reach that audience with the message. So if you want to reach the general public or the lay person, they're not going to read your academic article. You can make it open access and spend your $3,000 or $4,000. That's great, but it's not going to have any impact on you translating the information to those people. If you talk to those people, what will they consume? Well, they might look at a nice, pretty infographic of what you put together, and others wouldn't. Some people would be really interested in listening to a podcast from you talking about your research findings and what that means to their individual case or their individual practice. Others would like to read a news article in a newspaper. Others might like to watch a webinar about what you've done or watch a presentation. So you need to create a communications plan around it. And so that's anchored based on who your target audience is and based on what their preferences for consumption is. And it ends up being a multifaceted approach if you want to do it. And then I guess what we have trouble with as academics with writing in particular, because we write a lot, is how do you make sure that our writing is in a style that people will actually understand as well? And that's often where it's hard. My really simple tips on this is just to try and write with the same style you would in a newspaper. So look at a newspaper article and they talk about this funnel concept, right? So if you think about an article you read in the newspaper, you'll read the headline, you might read the first and or the second line, and then people kind of drop away. So if you haven't got your key message across in those first couple of lines, you're done. You're not going to get anywhere. And it's very different to an article where you build this background and you build this story. So that's really important to consider. And then from an actual what type of words to use perspective, just needs to be simple language. How would you tell your friend who is completely outside of your field and write it for them? I think that's probably, some key messages I'd put to everyone.
And Penny, look, I think it is a great question. I mean, obviously I am a qualitative researcher that publishes a lot in a field which is traditionally really a biomedically orientated field that doesn't publish qualitative research. So my target audience is often orthopedic surgeons. So I'm often trying to publish in orthopedic surgery journals, and it has been a real challenge to try to put my work into a format that orthopedic surgeons are going to read and it's going to resonate with them. So one thing that I have found really useful in this respect is to have, if I'm writing for orthopedic surgeons, to have orthopedic surgeons on my authorship team and getting them to be involved in the process of the research, certainly the review of the manuscripts, just so I've got my target audience alongside me through that process. as far as, I've got a role on clinical orthopedics and related research in the journal, that I'm also often working with the editor of that journal too. So to try to format things, or to have the, number one, the sort of research that the target audience is interested in, but also working with them during the formatting too, with the editors themselves, to get it into a format that the audience is going to resonate with. Writing up methods, that is, as Christian just said, the part that often people will skim over, and as far as qualitative research, people are so often not familiar with those, the jargon that would go along with a typical writing up of a method section of a qualitative paper. So just making sure that you're aware of that jargon and stripping out the complexity of it, making it as simple as you can. And again, having your target audience alongside for that process is helpful.
Okay, so we're nearly running out of time, but I'm going to squeeze one more question in here. This is a question from Nigel for Chris. You mentioned that industry has different goals with regards to publication versus business decisions. So should a PhD with an interest in entering industry still primarily focus on demonstrating skills and competence through publications?
Good question. My initial reaction is yes, you should. What the PhD is trying to highlight is that real rigor in research, and that rigor is really valued by industry. So don't discount what you're learning and what you're doing as academics. In industry, as I've highlighted, really are crying out for it. Too often the analysis that's done is done really quickly and poorly. And so if you're able to highlight through your PhD and your research that you've got those skill sets, and that's a real value add.
Awesome. Thank you so much. Oh, go for it. Get in
Can
there.
I just jump in? I had one final question. Christian, I loved all your stats, but the one that really stuck out to me was, if I heard it correctly, was that 11% of physios could cite a guideline. Is that right?
That's correct.
Wow.
Yeah. And
wow.
Yeah, that's mind blowing.
But the logical thing around that is the guidelines actually help a clinician. They don't at all. Like if you pick it up, it's and it goes back to that communication concept. It's this dense text heavy document that gives you no how-to guidance. So it says provide education, exercise and weight management as first-line care. RACGB guideline says weight-bearing exercise should be provided to all people with osteoarthritis. But they don't then say, well, here's a program you could refer them to, and here's how you could get funding for that person. And if they can't afford it, here's some resources they could get online, and is how to have a conversation to make sure they're ready for behavior change and etc. So that's the missing link. So why would you bother staying up to date with a guideline for your clinical practice? It doesn't help you.
That knowledge and skills divide, isn't it?
Yep.
Definitely. And a lot of clinicians, I'm sure, don't have that much time to be reading these really lengthy clinical guidelines. So thank you to our speakers and panelists, Sam, Chris and Christian, and to everyone who's sent in really insightful questions. It's been a really great session for us today, and I'm going to be handing over to Dan.
Thanks, Penny.
Thanks so much.
Thanks everyone for tuning in. And first I just want to say a massive thank you to all of our speakers, not just for this session, but the whole day. We've got a lot of very busy people who have given up their time through preparing the presentations and adapting to this online format, and also participating in the Q&A sessions. It's just been really great. And I'm sure everybody got a lot out of it. And if there were presentations that you missed or want to watch again, we actually have access as Opus to the Hoover platform for another 6 months. So you can access there and see what we've gone through today, and also access it via the Opus website, because I'm sure there's things you might want to revisit and get a bit more out of. SOMA, our student group, we've actually started a podcast, and 3 episodes have just been released onto iTunes today. The podcast is called The Orthopod, and yeah, we're really excited about it. 3 different presentations, so you might find something interesting in there, and we've got a few more in the pipeline that will be released in the coming months. And also keep an eye out for the Opus podcast. So thanks everyone for tuning in as an audience member, and it's been really great privilege to launch the forum, and we're looking forward to seeing you over the next 3 days. Plenty more sessions and workshops for you to attend, and it's going to be really great. So come prepared with questions and ready to interact, and we look forward to seeing you over the next few days.